GLP-1 medications are now in pill form, so you no longer have to deal with injections. But should you take them? Yes, they're more easy, but I'm going to try to explain to you why they might be a mistake for you. There are new complexities in taking a pill. You need to understand these hidden costs of convenience. You need to consider adverse events, side effects, and you need to know about how strict the dosing protocol is. Otherwise, the oral medicine doesn't work at all. Your stomach can destroy 100% of the pill. So we're going to go over how effective the oral pill is versus the injectable pill. Is this thing even worth it? The side effect tool, which you need to know about, and a choice matrix. So you have a step-by-step guide to know if you should switch, start, or stay when you're talking to your doctor. I'm Dr. Hawk. I'm here to empower you with evidence-based information. No fluff here, no gurus, just the facts. Feel free to check out my free newsletter, medicalwisdom.org, where I get more into the references and give also a personal take about how I handle some of these issues. The first thing you need to know about the oral pill is that your body absorbs this in a different way than the injectable pill, of course, because it's going into your stomach. The stomach acid likes to destroy this stuff as if it's food. So scientists have made a high pH bubble around the medication, which is called SNAC, no pun intended. This allows the medicine to pass through the gut without getting destroyed. So typically, only about 1% of the medicine actually makes it to your bloodstream. So you're taking 25 milligrams, normally 0.25 milligrams gets to your bloodstream. And that's functional. That's when it's working well. But if you don't follow the exact guidelines, not even 1% is going to get there. You can get to 0. So let's look at one of the first oral medications, Semaglutide, in 2019, Rybelsus, which is not very popular. It never became very popular. Semaglutide as Wegovy was recently approved in 2025, and that's probably why you're listening to this video. But let's just talk about the history a little bit so you understand where all this is coming from. So Rybelsus was approved for lowering blood sugars, and for type 2 diabetes, it did show about a 1 to 1.4% reduction in the hemoglobin A1C over 1 year, and it outperformed the injectable older version of a GLP called Victoza, which was used for diabetes. And people lost about 10 pounds, so not bad. And a lot of people still take this one, but 10 pounds is not that much. People are normally looking to lose more than that. So in December 2025, we got Wegovy as an oral pill. And what we see is that the weight loss amount is pretty close to the injectable version of Semaglutide. So we see about 13.6% weight loss with 25 milligrams and 15.1% weight loss at 50 milligrams. And remember, this is 68 weeks. So this is more than a year. It's not as high as we see with the injectable versions, which are more 15 to 17%, but it's pretty close. So the first thing to remember is that efficacy is pretty close, but not as high for semaglutide. And here's a key chart to pay attention to. So the oral tablet and the injectable pen of semaglutide. So the 25 milligram oral tablet, as mentioned, gets you about 13.6% weight loss. And here's the 15.1% for the 50 milligram tablet. If you're worried about your A1C and you have diabetes, you should also know that the A1C reductions are similar. Instead of 1.5 to 1.8%, you're getting anywhere from 1.5 to 2%. So quite similar. The injectable pen is once a week, of course. The oral tablet is every single day. The pen requires a fridge, and the oral tablet does not. So there's some convenience things as well. But remember, tirzepatide, also known as Zepbound or Mounjaro, is more effective than semaglutide. So if you're looking for something that's more effective, this is the winner so far. You get 15 to 22% of body weight over 72 weeks. So this beats Wegovy this week. This beats Ozempic. This beats Rybelsus. Beats the oral tablet of semaglutide. So in terms of just effectiveness, this is still the winner. Don't forget that. Now consider the side effects of the oral tablet. This is from the FAERS database analysis. You do have similar side effect numbers, 30% versus 27% or so, and slightly more serious events, particularly with gastrointestinal distress with the oral pill, which makes sense because you're taking the pill into your gastrointestinal tract. You're not injecting it into your muscle. And these side effects are particularly noticeable in the first couple of months. So there are side effect differences to keep in mind. They're not dramatic though. And what we see in the data is a higher discontinuation rate overall for the pill, about 13% for the 50 milligram dose versus 4 to 11% for the injectable. We also see a higher proportion of side effects that are gastrointestinal, as I mentioned, because it's going into your mouth, and a faster onset of these GI side effects, which all make sense because it's a pill, particularly nausea, vomiting, diarrhea during the dose escalation, during the time when you're increasing the dose is more frequent. With the injectable medication, we see a higher chance of endocrine-related adverse events, maybe because this injectable version gets at the hormonal side of things better But both formulations have similar rates of pancreatitis, kidney disorders, gallbladder problems, low blood sugar, and their pricing is not dramatically different either. So this is a nice summary of some of the side effects and other issues with oral versus injectable semaglutide. You may start on the oral pill and feel very frustrated, but remember, the first 30 days are the hardest. Peak nausea is going to happen at 2 weeks or so. And then by the time you're at 2 months, things should be getting better. Your body's going to adapt to the daily dose. And that's why clinicians tend to start low and go slow. And it's important to have frequent follow-up with your clinician. We tend to recommend more than once a month. Ideally, it's weekly. Now, here's the tricky part. When you take the oral semaglutide Wegovy pill, you have to take it on an empty stomach. You can't have any food, and you should normally take it right after you wake up. You should take it with 4 ounces of water, and you might think to yourself, oh yeah, that's just like a cup of water. I'm just going to take that down with my semaglutide pill. You should measure it out, because if you take more than those 4 ounces, you're going to decrease the absorption. And that's counterintuitive, because typically you think, why does more water matter? It's still all going into my stomach. It's just going to dissolve the medicine. It's going to all go to the same place anyway. The reason is quite complicated. I'm not going to go into it. Just trust me that it has been shown to decrease the absorption. That's why the label actually warns of this. And then afterwards, you have to wait another 30 minutes before having any coffee, breakfast, or other medications. In my experience, a lot of people can't do this. It's hard because you have to remember. But if you can't do this, remember the effectiveness is 0. It's going to do nothing for you. Instead of 1% being absorbed, 0% is going to be absorbed. So if you're the kind of person who can't do these kind of things every day for the rest of your life, you might want the injectable medication instead. The other thing to remember is this pill is going directly into your stomach, your small intestine, etc. So it might have a larger effect on delaying gastric emptying. Semaglutide, one of the mechanisms, is slowing the assembly line down. It slows the digestion, it slows gastric emptying. So it might have a larger effect on that, particularly when you have other medications involved. So if you have thyroid medicines, for example, you might have increased absorption. Your thyroid levels may be wacky. You need to watch those more carefully. Birth control. If birth control is not absorbed in the normal way, it can increase its levels in your blood or decrease its levels in your blood, depending on what's going on with the speed of your digestion. And there's many other medications that can be affected by stomach emptying. So you got to think about that with your doctor. Many of you are taking these medicines for cardiovascular risk reduction with weight loss. So we know with the injectable semaglutide, Wegovy, Ozempic, we know there's about 20% reduction in major heart events. That's amazing. The oral medicine is not as much studied, but there is some initial work that's shown in the SOUL trial, about a 14% reduction in major adverse cardiovascular events. So if you're primarily looking at oral Wegovy because you want to decrease your heart attack risk, you might want to wait for better research to come out showing equivalent benefit to the inject. But that's something you should talk about with your doctor based on your priorities. So overall, remember, about 13.6% average weight loss. You got to have this 4 ounces of water, 30% side effect with GI issues. You need to wait around more than a year, and it's going to cost you about the same as the injectable. Here's how I try to think about making this successful for somebody. Try to think of taking the medicine just like you do with any other habit in the morning, like brushing your teeth. It has to become part of your daily life that's separate from your other medications. So setting an alarm, deliberately having smaller, more frequent meals, that's going to minimize these GI side effects, nausea, and so on. And one of the other biggest mistakes people make is thinking they can eat whatever they want now. That's not true. Nutrition is a key variable in success with weight loss with these medications. So you got to go easy on the high fat foods, which tend to trigger vomiting. And then hydration is also an important thing. After that first 30-minute window on the oral semaglutide, you need to get hydrated, and you got to watch out for early constipation. We often recommend patients take some Miralax in their water a little bit every day. So watch out for constipation. So when you're talking about this with your doctor, you want to think about your lifestyle, your goals, your priorities, what works for you. Are you averse to needles? Do you have access to reliable refrigeration? Are you traveling a lot? Do you have a strong morning routine and consistency to make the pill work? These are really important things to think about before you just think to yourself, oh yeah, I like taking a pill better than injecting, so I'll just ask for the pill. It's not that simple, really. Injections may be better for you if you really want the maximum weight loss, which is going to be more than that 15%. Remember, tirzepatide, Zepbound, Mounjaro, you're going to get 22%, up to 22% weight loss. If you have these weird mornings that are chaotic and traveling a lot, or if you really want to make sure that your risk of heart disease is going to be decreased as much as possible, we don't have as much reliable data for the oral pill yet, 14% versus 20 to 26% for the injectables. Or if you just want to deal with this weekly instead of every day, you might want to go for the injectable GLP. So what I like to remember in talking about this with patients is that these are all great things. These are all clinical breakthroughs, but there's no cure. You have to have lifestyle changes, nutrition, physical activity, stress management, sleep optimization, all included. Consistency is going to be the key no matter which formulation you pick, but the best medication is the one you can actually take for forever, basically, because these are lifelong medications as far as we know. For most people, they are. And then you need to plan for side effects in the first month or two so they don't blindside you and you have a plan. If this side effect happens, what am I going to do? If that side effect happens, if I get constipated, if I feel nausea, do I have my go-to as needed medications, over the counter stuff? That's going to make this whole thing successful. I hope this has helped you. If it has, feel free to check out this other video. Feel free to join my free newsletter, medicalwisdom.org, where I give more scholarly references and go into a little more of a deep dive about my personal approach to things. Take care.